Screenings, evaluations, clearances. There's a lot of jargon in the assisted reproduction world, and it can be tough to keep up with. If you've ever wondered what exactly is medical clearance and what all does it entail, then you're in the right spot. What's up? I'm Corlandos Scott, an assisted reproduction attorney in Los Angeles, and my practice focuses on helping people grow their families through assisted reproductive technologies like surrogacy and egg donation. Now, in today's episode, we're talking about medical clearance, and I'm going to break down exactly what is medical clearance. I'll discuss how donors and surrogates are medically screened, and of course, I've got to touch on the legal implications of medical clearance. Let's go. You can think of medical clearance like a milestone, because that's what it really is. It's the most important and first phase in the medical process after qualifying to become an egg donor or surrogate. And it's necessary before the legal process can or should at least be started. It's like Charlie's golden ticket to the Wonka chocolate factory. Without the medical clearance, you can't move on and enter any egg donation or surrogacy agreement. Or I should say that you shouldn't move on to the legal process prior to obtaining medical clearance. And here's why. You're ultimately not going to work with a surrogate or a donor if she doesn't obtain medical clearance, if she's not healthy enough. So why would you spend the time, energy, and money to have a legal contract drafted, reviewed, negotiated, and notarized for someone who you're ultimately not going to be able to work with? I have tons of clients who are so in a rush to get started. They're saying, hey, Corlandos, our donor or our surrogate, she's in the medical screening process, but go ahead and get the contract ready and send it over to her attorney. We want to rush. And I say, wait, guys, I know you don't want to, but let's let her get through medical clearance. If you go through legal prior to obtaining medical clearance and the donor or surrogate fails, then you've wasted that time, energy, and money. And not only that, you're going to have to do it all over again. And again, spend the requisite amount of time, energy, and money for the second time to do the legal process with another donor or surrogate. So for the love of Pete, be patient and wait on medical clearance before you jump into drafting a contract for your journey. Generally, the medical clearance process starts with the psychological evaluation. Now, that may sound like something from a bad TV episode, but it's really not scary at all. All donors and surrogates should undergo a psych eval. But I also encourage all of my parent clients to do so as well. It's not about having a mental health professional assess whether you are fit to be a parent. Rather, it's to assess the current state of mind and readiness of both parties, donor and surrogate, and the parents, if you're ready to engage in a very intimate and unnatural relationship with another person. The process of assisted reproduction really requires some intentional thought and psychological adjustment in order to best prepare yourself for it. Also, on the side of the donor, and especially the surrogate, you want to make sure that they are of sound mind and capable of making voluntary, sound decisions. And most importantly, make sure that they understand that they will not, under any circumstances, be the parent of your child, and that there will be either, in the case of a donor, a child in the world with their genetic makeup that they are not the parent of, or in the case of a surrogate, they will deliver a baby that they are not the parent of. And they have to make sure that they understand that on a psychological and emotional level, and that they accept it and they are up for the challenge. Now, after the psychological evaluation, of course, the physical medical screening process begins. And this is where we screen for infectious diseases, and donors' medical records are examined, and their follicle counts are observed, and surrogates' medical records are examined, and they go through ultrasounds, and all this stuff is performed, and all the medical boxes are checked to make sure that the candidates are physically healthy enough to perform their duties as your donor or surrogate. Now that we know what goes into getting medical clearance, what exactly is the clearance? It's nothing as spectacular as a Pentagon-issued security clearance or anything, but you can look at it as security of sorts for you in the way of peace of mind, because it means that your donor or your surrogate has checked off all of the medical and psychological boxes to qualify to work with you. Now, it's issued in the form of a letter from the reproductive endocrinologist at your IVF clinic, and it's basically them giving their go-ahead for the donor or the surrogate and you as the parent to start the next steps of laying down all the terms and conditions of your arrangement in the egg donation or the surrogacy contract. Really, medical clearance is a guarantee or an assurance rather that the surrogate or the donor has completed all the initial tests and passed the screenings, and you can think of it as really a medical green light. By the way, the medical clearance is just one of two important clearances you need before the doctor can proceed with the egg donation or the embryo transfer. You'll also need legal clearance, which is issued by the attorneys after the contract is drafted and negotiated and signed, and before, like I said, the actual medical procedures can happen. But that's a topic for another day. So you may be asking, why is medical screening so important? You know, I've actually had people tell me, Corlandos, I want to work with my sister as my surrogate or my friend as my donor or surrogate, and I don't care if they don't pass those stupid screenings. They're close to me and I want to work with them, and that's it. Well, I have to tell them it's not a matter of working with any person you want simply because you both agree, regardless of the screening process. You just can't do that. There are actually requirements and guidelines for this process. For instance, the FDA requires a thorough pre-screening of any egg or sperm donor prior to IVF. You also want your donor to be screened by a genetic counselor. You have to make sure to eliminate possible risks that may be present by the presence of hereditary or genetic diseases in your donor that you're also a carrier for. Likewise, the American Society for Reproductive Medicine, or ASRM, is an organization in which most of your responsible and noteworthy fertility experts are members, and they have a number of guidelines for gestational carrier requirements, and they range everywhere from age to body mass to number of previous pregnancies. And you can rest assured that if you're working with a reputable fertility clinic, they will follow the guidelines of ASRM. And the reason is because third-party reproduction, and really, let's be honest, pregnancy in general, it involves a lot of risks and decision-making processes that affect the life and the rights and the well-being of each party. And no professional worth their salt wants to place a potential surrogate at more risk than is necessary. So if the potential surrogate isn't medically cleared, it's probably for her and your own good. So let's look quickly at how donors and surrogates are medically screened. Here's a quick rundown of standard tests that you can expect, and it goes through the donors, the surrogates, and the intended parents' medical records, and even family histories in order to check for the presence of infectious and genetic diseases or any conditions that would present risks, big or even small, during the process. For the medical screening, the surrogate or the donor will have a physical exam, a pelvic exam, ultrasounds, and even blood tests. Now, on the donor side of things, there should certainly be a genetic screening in order to understand and assess the risks of transmission of a genetic disease. After all, your child will share the egg donor's genetics. Also, a psychological screening should be done to identify any potential emotional problems or triggers because you want to determine motivations and address that your donor and surrogate has an understanding of all things like the physical, psychological, and emotional risks that may result from being a donor or a surrogate. Now, let's wrap things up by looking at, of course, the legal implications of medical clearance. But before we do, I'd love your feedback on this topic. Drop me a comment below and let me know whether you considered all the implications of the medical clearance process prior to your journey. Or if you're thinking about starting a journey, have you considered them? I respond to all my comments, so drop me one. And while you're in the comments down there, just slide the mouse right up and to the right and click that like and subscribe button. Go ahead, I promise you it's therapeutic. So are there any legal and ethical implications of the medical clearance process? Well, I think there are legal implications to everything, so yeah. First, the medical screening process speaks to the donor or the surrogate's willingness or even voluntariness. Is that a word? Voluntariness? We'll make it one. Their voluntariness to participate in the journey. Also, the items that go into the medical clearance process unveil the potential risks that are inherent to donation and surrogacy, and it gives the donor and the surrogate a chance to acknowledge and learn about those risks. I guarantee you, every good ART, or Assisted Reproductive Technologies contract, is going to say that the donor or the surrogate is aware of the risks and will not hold any other party responsible if any of those risks materialize. So, it's important that the donor or the surrogate use the screening process to actually familiarize herself with those risks. There's also the legal issue of the potential conflict of interest in the physician's donor-patient relationship. Well, what is that, you ask? Well, both the intended parents and the surrogate or the donor are patients. And although the intended parents are paying the medical bills, the surrogate and the donor still have individually recognized rights to the proper standard of care from the doctor. So you have one party paying the doctor, but the doctor is also beholden not only to that party, but another party that's being paid for. So that presents a potential, keyword, potential conflict of interest. I think really that this is more theoretical than actual, because I don't know any reputable doctor who would jeopardize his or her medical license to allow the potential conflict to rise to the level of an actual conflict. So what am I trying to say? Don't try to skip the medical clearance process. When the doctor or the clinic issues medical clearance, it's being issued to assure safety for both you, the intended parent, and the surrogate or the donor, and most importantly, your future child. If you're looking for more help on how to grow your family through surrogacy and protect you, the donor and surrogate, and of course your future child, I have something special for you. I call it my free Surrogacy Secrets seminar, and it's going to show you how to go from dream to delivery in growing your family through surrogacy without losing sleep, without losing time, without losing money. It's absolutely free, and if you want that, just click the link in the description box below. I'll see you in the next episode.